Hi, everyone. And this week, what we're going to be talking about is it normal to experience pain after breast cancer intervention? So that's kind of the topic for today. So let's chat. Now, what are the things that typically can contribute to pain? Well, it could be shoulder pain, which is going to be more specific to like, oh, I move my arm up or behind my back, and like specificity of like pain in the shoulder with movement. There could be something that's called axillary web syndrome, where you get this tightness that happens when you raise your arm overhead that could kind of pull into the upper arm or armpit area. You could have scar tissue adhesions, which is going to be along scar lines where they don't move well. So then when you stretch too much, that hurts. And then there could be something called myofascial pain syndrome, which is development of trigger points that can cause local pain or pain that travels. So we'll talk about each of these. Now, why are we talking about this with Breast Cancer Awareness Month? Well, these are common. These are things that are very common that you can experience after breast cancer and breast cancer related intervention, which could include, I don't know, surgery, right? So if you have surgery, look at these muscles right here, right? So if you have a mastectomy or removal of your breast, any of these muscles in that region could not be super happy about you having that surgery. Plus lymph node removal, which is right there in that armpit area. It's super common that some of these muscles are just like not happy about the procedure. That doesn't mean that it's ignored. You just treat them, calm them down, and typically they're like, oh, cool, thanks for a little bit of help. And then they simmer back down. So that's common after breast cancer. And the other thing is how does physical therapy and breast cancer kind of work together? Well, during October, with it being Breast Cancer Awareness Month and Physical Therapy Awareness Month, let's continue to talk about the combination of the two of those and how we work hand in hand very well. So shoulder pain could be muscle related. It could be joint related. So the way that joint related pain happens typically is because if something hurts and you stop moving your arm for a period of time, then the capsule itself can get stiff. And so now that you have the stiff capsule on top of the muscle pain, now you really start to get some pretty limited motion, which can cause, bursitis, tendonitis, potentially lead to a frozen shoulder, all different things that are typically 100% preventable, as long as you're, working with somebody that is competent in teaching you what is a safe range of motion versus too much or too little. So there's that happy place whenever you're recovering from surgery. Now, myofascial pain syndrome. So this is one that's kind of like, oh, big word, myofascial pain. All it means is that trigger points develop in the muscles. Now, this one, like if you look at the information on here, nearly half of women develop myofascial pain syndrome within the first year after breast cancer surgery. And so why is this so common? Well, I just kind of talked about the muscles that are around these treatment areas. Plus, we've got maybe reconstruction, which is more trauma to the area. And then also you have, stress, you've got periods of immobility, you've got the stress of radiation and chemo on your body. So you're just like still for longer. Our bodies like motion. Motion is lotion for the body. So the more that we stop moving and we get kind of stiff and then things can start to get painful, the muscle bands actually like to kind of start to knot up and tighten up a little bit. And that creates these little bands that are called trigger points. And so trigger points can be one of two types of trigger points. A latent trigger point is one that you don't even know is there, but then you touch it and you're like, whoa. So if I'm like my upper traps, for example, it's like my neck doesn't hurt right now, but I'm like, oh, wow, that is really sore right now when I press it. And when I press it, I might get pain that kind of travels a little bit, like how does that, like I didn't have a headache, but now I start messing with this and now I get a headache. That's a latent trigger point. So it was sitting there and it wasn't provoked until you touch it, okay? Now that latent trigger point can easily turn into an active trigger point, and an active trigger point is something that's actively referring pain. So it could be pretty local to the area. It could be referring pain up. If it's in your arm, it could be referring pain down or across or to the shoulder blade area. All of those are very, very common. So these are the common trigger points that develop after breast cancer related intervention. So the muscle that sits like right in that armpit area, this muscle in here sits on the front of your shoulder blade. It's called your subscapularis. So when that muscle gets trigger points, it refers pain into the back of the shoulder. How crazy is that, right? So now it's like, oh man, my shoulder is just aching. It's all back here. And then I'm like, oh, well, let's just see what's going on. I poke this and whoa, like what's going on there? I'm like, well, there's a trigger point in your subscapularis, which is creating some of this pain in the back of your shoulder. We just confirmed that. The weird thing, right, is that it can also have pain that travels down the back of the arm. You can see that in the picture here, and then into the wrist area. So that could mimic, maybe I have something going on with my neck that's referring pain, but all of the neck imaging is negative, and people are like, oh, I don't know, you must be crazy. No, make sure that you haven't ruled out that there's a trigger point that's creating referred pain into the arm. Other muscles in this area also refer pain into the arm. The pec major, the pec minor, the serratus anterior are all muscles in this region that can get really mad, that can also refer pain into the arm and cause that achiness and discomfort. And so never rule out that something is going on if you are having symptoms. That's all. And then if you are, make sure that they get treated by somebody that's competent in treatment of myofascial pain syndrome. Now, scar tissue adhesions. This doesn't happen to everybody. Some people are more prone to scar tissue adhesions. Some people are less prone. It is what it is. There's no way of absolutely preventing any of all of this. There's ways to decrease the likelihood, but we can't prevent anything bad ever from happening in life. But so just know that if any of these are affecting you, that's okay and quite normative, actually. Now, scar tissue adhesions could occur along the scar line, meaning that that skin isn't moving like it should over the tissue that's underneath it. So if I take the skin on my arm and I stretch it this way, it moves. This way, it moves. I go down, it moves, and I go up, and it moves. So your scar should move in every direction that you try and stretch it. If it's not moving and you've had time for it to close, okay, not an open scar that has like new stitches or staples or steri strips on it, but it's had time to close, and it's not moving in one of those directions, then that could be what's causing some of the pain or immobility, especially with raising the arm overhead, okay, or kind of opening up that shoulder. And it's like, oh, that really hurts right along my rib when that happens. Well, that scar after the mastectomy could be getting kind of a little bit too tight against the rib, and then that creates the pain. So what do? We immobilize it. We get it moving. Now, axillary web syndrome, another thing that's, it's not super common after breast cancer, but it does happen. And so this means that the lymphatic system itself is getting stressed, and some of these vessels, okay, they can start to fibrose. And when they do, they'll get kind of adhered to the different layers of tissue. So if you're raising your arm, it's like you'll feel this pulling that happens along the vessel, along the fibrosed vessel or vessels. And then oftentimes you can see the pulling in the armpit itself. And it hurts. It's like, oh, if I go further, that only gets worse and worse and worse and worse. So people stop moving. And do you see where, like, if you stop moving, now that contributes to the shoulder capsule getting tight, which contributes to the rest of the muscles getting tight, which can contribute to the formation of trigger points. So we've got to normalize motion as quickly as possible after breast cancer related treatment in order to stop that cascade of events that can happen. So again, knowing that pain isn't normal is helpful. Post-surgical soreness, normal. Significant pain with raising your arm overhead and it's been more than a couple of weeks, not normal. Could be axillary web syndrome. Now, this is kind of what you might see in the armpit area. So see that kind of those bands. So a screen in the mirror is like a very helpful thing to do. And the other thing that you can do is you can take the skin, take your thumb, and then just try and pull your skin away from your armpit and see if you can see any bands sticking out or any pain that occurs in the armpit. That should not hurt my armpit to do that. If it does, then it could be because of cording. Simple little screen. Now, treatment options, what do we do about, especially like cording? That seems kind of like a weird one. Well, sometimes what we'll do is we'll actually like try and free up anything that's adhered around that stressed vessel, okay? And this is in general, like anybody that needs to have any treatment done, right? We're just going to try and clear up anything around the area that's not happy. So we could be doing fascial techniques, soft tissue techniques, manual lymph drainage. We might be doing things with modalities like some tools, cupping, depending on the area that's involved, some dry needling. And then we're always going to, whatever new motion we get, like if your arm was like only going to 90 degrees and we mobilize some stuff, we get things moving. And then you're like, oh, look, like now we have 120 degrees. Now we've got to give you an exercise to help your muscles defend the new motion so that the motor training and motor control can start to defend the new motion. And so that's essentially what we do, is just like find what's going on, treat the impairments, and then give you something to do to support the treatment. Now, if you have any questions about this, like, is this pain normal? Is it not normal? I'm talking to a friend of mine, and I really think that what he or she is experiencing is more than what they should be experiencing. Then give us a call. So the number's right there. Oh, sorry, I put the wrong phone number on there. It's 0200. So 734-0200. And the email address is jess@ceptwellness.com, or check out the website and find out more information, and you can schedule right from the website as well. So everybody, thank you so much for joining in. I appreciate you staying tuned for what we've got coming up next. All right.